Hi, I'm Dr. Canova. I'm the clinic director at Hoboken Integrated Healthcare. I'm here with Jezebel today.
Hi.
And we're going to ask Jezebel a few questions about the treatment she had in our office and what brought her here. So let's get right into it. Tell me a little bit about what brought you in to see us at Hoboken Integrated.
Well, I had my wrist. First of all, I'm a bartender. I'm an actor and a bartender, and after I would say 3 or 4 months of bartending, my wrist, going back to bartending because I had left bartending for a long time, my wrist and my hands started to hurt. But like at one point, it was excruciating pain. I couldn't. One night, I couldn't sleep from the pain. It was pain around my whole wrist, going up into my thumb and this portion of my thumb too, and into this bone here. And so I had gone to an orthopedic, and the orthopedic gave me some prednisone to reduce the inflammation. And I took it, but I still was feeling some of the pain and discomfort, and I didn't have any flexibility. So I've always gone to a chiropractor. I have scoliosis, so the chiropractic, I believe in it very much. It always made me feel better. And so I said, let me see if you guys can do something. So I came, and then the rest is history, and you could ask me something else.
Yeah, well,
then I came
when Jezebel came in, she had told me she'd been suffering for quite some time with this. Although you had done some treatment, nothing had really gotten rid of or resolved the problem. Is that correct?
Well, I before coming here, I didn't have any treatment.
Okay.
The orthopedic just gave me the prednisone.
Well, they gave you prednisone, but you didn't have any physical therapy.
No, I didn't have any physical therapy.
She basically had medicine. When she came to us initially, we did an evaluation, and one of the first things we did was electrodiagnostic testing.
That's right.
We did an EMG and CV testing. Dr. Salmon on our staff, who's an MD, so we concurred after the findings, and the findings did show that in fact she had a pretty severe carpal tunnel syndrome, and she had a cervical radiculopathy. So she had what's called a double crush syndrome, a problem in her neck and a problem in her wrist, meaning that both had to be treated concurrently. So tell us a little bit, well, let's back up a little bit. After that test was done, I remember we had a conversation about whether we thought you would need surgery or not.
Right.
So I had a conversation with Dr. Salmon, who did the test here, and she was very close to being borderline as going out and getting cut. She had a little bit of atrophy, a little bit loss of the thenar eminence in her right hand. She was starting to lose strength, and many doctors, this might be a surgical case right away. Because she couldn't afford to be off work for 3 months from the surgery, because I thought she had the willingness and the desire to undergo a therapy program, and I thought she would be compliant, I let it rest with her, and I said I can go either way. You know, not everyone, some people I'm going to cut bait and say you have to do surgery. Some people I say you should definitely do therapy. And with Jezebel, you know, we were like, you can go one way or another. And, you know, I would lean towards a more conservative approach.
Well, I would too. Well, I would too, only because I do want to use, you know, to me, surgery is last resort. You know, it's the last resort. I really try to be with my own body and my own decisions as non-invasive as possible. I don't mind doing the work, and I think doing the work is also is going to be, in the long run, more beneficial to the body itself, because if I learn how to use my hands properly and I learn new exercises, in the future, I would be better. If we just snip, and I keep doing the wrong things, and I don't exercise the hand and strengthen it and heal it from within, it'll come back. Right. That's what I was thinking too, and that's what you said.
Possibly on the other side as well.
And possibly on the other side, exactly. So
tell me about what we did, how we started.
Okay, so we decided not to do the surgery, which I was very happy about, and then we started with stims, which is called you know, the electrodes for the pain, electrical muscle stim for the pain, and then we started slowly with some exercise because I still had a lot of swelling, and you know, I didn't have a lot of flexibility. So we started with the stims with massages and ice, and then some light stretching.
So she was seeing the chiropractor here for your neck.
Yes, for my neck.
And the physical therapist for her wrist. So we were co-treating with 2 different professionals on 2 different areas of basically the same problem of inflammation of that double crust syndrome.
Right, because the EMG showed that a lot of it was coming from my neck. So
Right.
even if you do
Neck
the surgery
and
on your hand and you don't fix your neck, it's going to come back.
So we worked on both concurrently.
You worked on both concurrently, yes. And my neck was feeling bad. We were doing decompression. We did decompression and chiropractic, and then physical therapy on my hand. And I immediately, within the first, I would say, first of all, I had to rest my hand and ice it a lot because it was really swollen. After that, after 3 weeks of
And we got you a
physical therapy,
splint, too.
We got me a splint. And the splint helped tremendously too because, you know, I couldn't really exacerbate it. You know, I couldn't really would aggravate, any movement would aggravate it. So I had the splint. I would use the splint for sleeping and for working. And most of the day, but sometimes I did have to move it around, especially, of course, when I came to therapy. And then we would do the exercise. So after 3 weeks of wearing the splint, decompression, chiropractic, and the exercises, I was already feeling better.
And in the grand scheme of things,
That's weird.
For the significant problem you had, 3 weeks is.
Well, 3 weeks
is I mean, it was intensive.
It was intensive. It was 6 days.
But
you know, altogether.
That's pretty significant as far as improvement in that period of time. Sometimes it might take triple that time, or 3 months before you see the type of improvement that you had.
Well, I think also. Then it slows down afterwards. Like it was quick initially, and now it levels off. Yeah, that's what I think is happening. I'm at a really good point now, but it still is kind of like, you know, weak. But its flexibility is back. Well, let me just tell you then what happened. And then it got better, so we reduced it to 5 days a week as opposed to 6. That's including chiropractic and therapy. And then I've been coming for 3.5 months, I think, because we started at the beginning of August. So 3 months. 3 months, and to me, I'm ecstatic. I'm ecstatic because I feel so much better. I was a little bummed, yes. You know, for me, a little bummed is extremely depressed for most people. So I was bummed that I might not be able to use my hand again. And I mean, and that's serious, you know, and even in acting or writing. As a writer, I do a lot of handwriting. I don't only work on the computer, but I do work a lot on the computer. So, I mean, I needed my right hand.
And this is a very vivacious person. She's full of life, but when she first came to me, she was in tears. You were in tears, and she was pretty much broken, physically and mentally, as a result of it. Will you dare say that?
Yes, I would dare say, sure.
And it was a serious situation. I didn't know for sure if I didn't make any promises, but I said we're going to do our best.
Very honest with me, sure.
And she stuck with the therapy. She was very compliant, which is a big part of it. And you've made steady improvement along the way. The weakness in the thenar has come back in a relatively short period of time. She's probably about a 0% chance of needing surgery right now. We moved you to a different splint, one that's less hardcore, that she can still work with.
It's a little bit more flexible as opposed to keeping it completely straight and still.
Still protect you, but able to do your work, able to do both your jobs.
I'm able to do, yes, exactly. I'm able to do much more. I'm able to do my acting, my writing, and the bartending. What I was going to say, too, about the getting the treatment here as opposed to any other place specifically, was also, I have a peeve about doctors not listening. Okay, so here it's very individualized care. You know what I mean? It's not just, you know, one size fits all kind of thing. There are, you know, things that you do for similar cases, but I feel that you listened to me when I was telling you about my story, even though you probably heard it 100 million times. But everyone's different, you know, and everyone has different jobs too.
Yes.
So he listened, you know, they listened. And the day I didn't want therapy, you know, because kind of was bothering me, hurting me, swollen, I didn't get it. Everybody was like, you got to work at your own pace, at what feels right. But, you know, this is the kind of response I got, you know, from you. No, we'll take it slow. We'll do what's good for you, what we know that you should need, but how you can handle is a whole different thing.
Right.
So we worked at my own pace. They listen. You know, I just wanted the weight increased actually today. There's a weight that we're using because I feel like it's too light, and he gave me the heavier weight, and I want to challenge myself. You also have to put in a lot of work yourself,
right.
You know.
So the compliance is
a lot of work. The compliance is a lot of work, but they're great listeners, and there is progress. And I just feel like you guys. You also got me the stims. You know, they got me stims so I could use at home. And the neck decompression one. What's that called? The one that you take that's portable. It's a little neck decompression thing. I don't know what it's called.
Oh, it's the cervical pump.
The cervical pump.
It's the posture pump.
I didn't even ask for it, and you guys ordered that for
we
me.
need to restore the
which
cervical
is
curve in your neck,
fantastic.
which is going to take pressure off the nerves in your
So
neck.
I'm sort of doing decompression at home, so to
Right.
speak.
Yep.
And I got that, and I didn't even ask for it. So they're on top of your particular case, which is what I love. You know, they're really, really on top. They know exactly what's going on with you and what kind of progress you should need. I don't know. With other doctors, I felt kind of ignored, like lost in the shuffle. But here, you're not lost in the shuffle. Everybody, seriously. So that's important to me, that you listen and you're really in tune with each patient.
That's
I
awesome.
have to tell you.
I really
And I
appreciate
feel
it.
better. What
I
more
appreciate
can you
that.
say about that?
One last question. If there's somebody out there who has this carpal tunnel or has the neck pain, and they're considering surgery, or they're sitting on the fence, they're afraid to come to a chiropractor or a physical therapy, or here in Hoboken they're not sure, what would you say to someone like that? What would you, if you were to meet them and talk to them, what would you say to them to let them know, or to give them advice from someone who's been there?
Well, what I would say, without disregarding somebody's, pain or individualized, or a doctor, disrespecting the doctor, disregarding the kind of pain they have, if they know they have carpal tunnel and even a particular kind of tendonitis, which I also had, if they have that, I would say, first of all, you have nothing to lose by going to chiropractic. You get an evaluation, you get a consultation, you get that EMG, which most doctors use, actually, all kinds of doctors. You get the EMG test that tests the electricity running from your neck to your arm. I would say, what have you got to lose? You go to a consultation, you see what happens. And then, to me, non-invasive is always the way to go initially.
Right.
You go to therapy, and if it doesn't work, then you go and get the surgery.
Right.
But if you have the surgery,
You can't
go back. That's what I think. So I think it's very important to first try. In my opinion, what I would say is, if you are in a lot of pain, you let them diagnose you. Let them evaluate you, a chiropractor, and see if you could use some physical therapy, and then go from there. Make the decision from there. And you guys, I would definitely recommend you guys also, because you would be honest, and you would say, listen, you might need surgery.
You were close,
because
very
he
close
was
to that
close
point.
with me. Yeah, you told me that. So I'm like, you'd be honest.
Right.
You'd be honest with the person.
And I think in your particular case, the integrative approach, having the chiropractor and the physical therapy, because you definitely needed both.
That's right.
If you weren't here, you'd have to run around from one office to another.
It's all in
so
one
the
place.
fact
It's
that you were able to
fantastic.
do it all here and integrate it, I think actually made a big difference in your particular case.
Yes, it did. So I would definitely recommend chiropractic, this place, especially because you can get both at the same time. No, I would.
Yeah.
But, chiropractic in my case, because I had the double crush, chiropractic and physical therapy in one place. And I was already getting annoyed with the 6 times a week, because I needed it, but it was a lot, but I needed it. But imagine if I had to go to another place, 6 times a week, it would be hard, back and forth.
It's almost impossible.
So this, that's what I would recommend. First, try chiropractic and physical therapy, because, why get chopped up if you don't need to?